Champions of Psychology is meant as education and entertainment. It is not a substitute for medical advice or professional counseling. Discussion of mental health topics will be primarily rooted in research and the personal experiences and self-disclosures of the hosts. While we can provide generalized education and possible mental health resources, we cannot offer any recommendations, advice, or opinions for any specific persons, cases, or situations. We provide these resources and links at our sole discretion, but have not necessarily vetted or reviewed any resource. We assume no liability for the use of the information or resources on these sites, and we encourage you to use your own best judgment.
Hello, and welcome to Champions Psychology, a show with the goal of openly talking about mental health and gaming, presented by Codename Entertainment and TakeThis.org. Every Tuesday at 12 p.m. Pacific Standard Time here on twitch.tv/CNE Games, Mitra Jordan and Raffael Boccamazzo, aka Dr. B, talk about mental health and gaming and how gaming affects us. There we go. That's what that sentence reads.
That's what we do.
If you're here with us live in the chat.
It is what we do. Sorry.
No, it's okay. If you're with us live in the chat, you can leave a question that I, Treavor Bettis, will ask them later in the show. And our topic today is about therapy and when it's right for you. But before we get to that, who are you two fine folks for the people who may not know?
I'm Mitra Jordan. I am a registered clinical counselor in Victoria, BC. I work with individuals. I often work with couples. I occasionally work with families. And lots of times we talk about games and ways to incorporate games or even game strategies into your life. So, and of course, just games are fun generally. And I like to nerd out and geek out about them. So yeah. Okay, now I'm trailing off. So so somebody take over, aka
someone with
Dr.
a last name with long Italian name reasons. Go.
Long Italian name reasons. I'm sorry, that's your short name now.
That's my short. That's my short name now. Yeah, no, long Italian name reasons. Ironically, longer than my actual name. Hey everybody, I'm Raffael Boccamazzo, better known as Dr. B for the aforementioned long name. And I'm a clinical psychologist in Washington State in the United States. I am the clinical director over at what was the first mental health nonprofit to serve the game community, Take This, which, by the way, on the 7th of November is our 10th anniversary as an organization. I cannot believe
that.
I cannot believe we're here a decade later.
Wow.
What I really love about Mitra's joke there is it works even with the old movie Analyze This and Analyze That. But that's fantastic. Congratulations.
Yeah. So go check out TakeThis.org. We've been very fortunate over the years to have Codename Entertainment and Idle Champions as just really ever-present sponsors and supporters in so many wonderful ways. And I've got nothing but good things to say about the company. So
that's awesome.
Yay.
Well, today we're going to be talking about how do I know when therapy is right for me? And I think I want to start off, that question the way that we normally start these off with, why are we talking about that?
Are we talking about how to find a therapist that's right for me?
It's just the title was.
How do I know this therapy?
How do I know this therapy?
This therapy is right for me. We have a typo.
Not that therapy. This therapy.
Specific therapy, not as they or how things are going in therapy. Although could be.
Well,
could be useful.
There's a lot of types of. There's so many types of therapy. There's so many types of therapy. I'm a psychologist, and there are so many times where I'll get a therapist who say, "Well, I practice this kind of therapy," and I'm like, "Huh." I do not know that. Can you explain that? And it's an offshoot of this other offshoot of this other offshoot. And I know the foundational principles. I just didn't know it by its proprietary name. And if I went through the 24th grade for this, what hope does the average consumer have?
Mm-hmm. Yeah.
So that's why we're talking about this. Like, what's the difference between psychodynamic therapists versus like behavioral versus cognitive behavioral versus humanistic or attachment oriented? Mitra,
that's me.
What's the difference between all of this, and how do you as a consumer know what to look for? And is this the right type of therapy for moi?
Moi.
Yeah.
Well, okay, so how do we want to tackle talking about, like, do we want to talk about what those differences are, or what do we want to do there?
I don't. Well, I mean, I'm curious. I'm actually really curious what the chat wants to know about this one, and so chat, get those questions in.
Yep.
This
Question
is
colon, and not specifically you question colon, but
yeah, we're
right,
looking at you.
the all caps question and then the symbol colon and then your question. I gotta be more specific now because of you.
But
yeah, let us know in your what the questions are. Awesome mods. Jordan and Mars will grab them, put it into a little text doc, and we'll talk about them later in the show.
Yeah.
Yeah, I mean, I think I'm going to start in with when people come and see me, they are at some level looking for specific things out of therapy. But I do think that if you are searching for a therapist and you're looking online and the therapist says they practice this modality or they practice that thing, it doesn't necessarily mean much. I mean, you can research it and go, okay, maybe that sounds like something I'm interested in. But I think it's kind of, I think it's tough enough to get to the place of like, I need to see someone. To then have to kind of wade through all of the different flavors that are offered, I think can be really confusing to people. And also, something that sounds like it might be a good thing to try isn't necessarily practiced the way it's presented when you just read about it. So if you read about a therapist who is like me, a somatically oriented therapist, which means I kind of take your embodied reactions and emotions into account when we're sitting together, and I might ask you some questions about how it feels when you say certain things, or what sensations and feelings do you notice. But that doesn't come up with every client, and it doesn't come up all the time. But I am a somatically focused therapist. So you can see how it could be really confusing if someone learns a little bit about somatic focused therapy or trauma therapy, like Peter Levine's work. See, now I'm starting to even get esoteric, and my companions here are looking at me like, because we're going places we don't need to go. But the point is, there's so much information that's presented. How do you, as the consumer, make sense of that?
I think one of the other things, just from my perspective, is knowing what things I not only need help with, but that I can get help with.
Yeah.
Well, one thing I want to throw out there, and we in our planning document, this is lower on the list, but I think it bears mentioning now. The research is pretty consistent on the idea that the type of therapy you engage with is actually less important than the relationship with a therapist. And if you think about it, that actually makes a lot of sense, because the way somebody approaches something is less important than, do you trust that person enough to work with them? Do you trust them enough to be able to be vulnerable? Because there's so much vulnerability in therapy. And if you don't have that really, really good working relationship, then whatever techniques they're going to use are irrelevant. It doesn't, it won't matter if they're psychodynamic or cognitive behavioral or, humanistic or so forth. If you don't have a good working relationship, the rest of it is kind of irrelevant. So I would say, if you're out there looking for a therapist, worry less about the type of therapy and more about, do I jive with this person? Do I trust this person? Can I resolve, if problems come up in therapy, do I feel like I can resolve that with them? Because, you're going to have
Are they
conflicts.
upfront about how you resolve them?
Yeah.
I think that's a big one too.
Yeah.
So we thought a little bit about, first of all, what sorts of interventions belong, if you will, with which modality, but also, how does it feel to just be sitting in front of that human?
Yeah.
That's the single most significant thing, because if someone works within a certain modality, that may help them conceptualize your situation. And lead to certain types of useful questions
Mhm.
or ways of approaching your world. But ultimately, it's you and another human being, and they're present to your situation. And that perhaps is the single most important thing I think that one should look for is presence.
God, yeah. Do you feel like that therapist is actually listening to you?
Do you feel like there is
Yes.
another person in the room with you?
Yeah. Or are
Yes.
you just shouting at a wall?
Yeah.
Are they alert and present?
Yeah.
Are they with you?
Okay,
Mhm.
I know we don't quite have it on there, but like, what are there things that that people might be able to look for to know that someone is being present, or is it just like that you feel that on a personal level?
No, I think you can look for it. In fact, I worked with another therapist at one point early in my career, and I still remember this. And he was really illustrative of what not to do, actually, unfortunately. So we're in this room with an older couple, and they've got a bunch of issues and years of sort of dynamics that are challenging for them. And I'm not really sure why. I'm not really sure because I was in my internship at the time, what it was that was useful about having the both of us therapists in the room, although it was certainly useful for my learning process. But in any case, the senior therapist at the time felt like it was really important to do something called a gosh, I forget. But anyway, he decided he was going to put together a sort of history of at this point, the male client's life, not somehow the female client's life, and not somehow both of them at the same time. So he's asking all these questions. The female client, remember these two are older. She's practically falling asleep in her chair. I really should have thought to take her into another room, but again, I'm early in my practice.
Yeah.
So she and I are sort of sitting there uncomfortably across from each other, sort of kitty corner, if you will. And we're just silent while this other therapist takes the guy through his life history and his family and his, and he gets to the guy's brothers and he asks about the brothers who are all deceased at this time. But, just sort of laying it out. Are you the middle brother? Are you the eldest? Whatever. Anyway, the next session, which is 2 weeks later, we're talking about supports for this couple. Who in their lives is there for them? Who can they do things with? Who can be present for them? And he says,
No.
So what about your brothers? And I was horrified. And the guy the client just, they're dead. Like we talked about last time. And I'm just like,
That's God. Okay.
Yeah. And as soon as he said, what about your brothers? I'm like, they're not, they're not with us. They're deceased. And the guy's like, they're dead. And he's absolutely infuriated, rightly so.
Yeah.
There's
Oh
an
my
example
God.
of complete absence.
Ooh, yeah. That's
When it's
that's
also
a great example of jeez.
Well, the advice I like to give people is think about the markers for presence that you look for in other areas of your life. Like we all have different expectations of interactions. Like, is the person responding to my questions? Are they responding in a way that's on point? Are they firing back with self-disclosures that are relevant to the situation? And all of those are possible markers of presence in your therapist. And so that's really active listening is a big one for most people, I think. Are they asking follow-up questions that are relevant? Are they asking follow-up questions that are completely antithetical to the situation, like asking if your dead relatives are a good support for you?
Probably not.
I don't want to say that's an impossibility. There are a lot of individuals with ancestral
sometimes I'm
cultural
having a bad
practices.
week and bust out the Ouija board. They make it feel everything better.
It's
so yeah, and it's oh yeah. I think that if you're going to take notes as a clinician, read them
oh God,
afterwards.
yes.
So otherwise, just why are you doing it? But
Yeah.
I think paying attention to a person's, not just a person's story, but their body language around their story, what their experience is, what do they seem to notice, what sorts of cues are you picking up
Yeah.
about their experience. I want a therapist who picks up cues, and I want to be able to call on my therapist for the cues that they have. I had a client once who was really sensitive to the lack of presence. And at one point when they came in, they were saying something, and I usually got them tea. So this is pre-COVID, of course. So they come into my office, I'm getting them tea. So I'm bustling around a little bit. And at one point, I look up, and then I come and hand them the cup. And they're like, "Did you just roll your eyes at me?" And it's like, that's really interesting. I didn't, but let's talk about that. Right? What did you notice about that? What did it say to you? And we got into it. And this is someone who had experienced disrespect in their relationships and absence in their parents, and a lot of challenges interrelationally. And they asked a question that I'm not sure they would normally have asked of anyone.
Yeah.
And if I had just said, "Oh, no, I didn't, you must have misunderstood, here's your tea," I would have missed a really important opportunity to just be with them in that, and just really understand where that was coming from for them. So what I'm talking about is, as humans, we project onto people around us our own experience without realizing that we're doing it. But in therapy, that's so critical, because they could ask those kinds of questions that they might otherwise push down. If their partner or sister or whoever may have rolled their eyes or whatever, they would have just gone, "Oh God, here we go."
Yeah.
Right? But they were in a situation where they asked it and we could get into it.
That's true.
And it's so important to be able to do that with your therapist.
Well, and that's where the trust comes in.
Yeah.
Because and I see this in like a lot of the questions that we're getting. A lot of it, like the majority of the questions we're getting in the chat, seem to revolve around like a plateau in therapy, or a potential conflict that people don't know how to bring up. And I think we're probably going to get into those specifics a little bit later. But this is part of the reason that the trust is so important. One of the things that I tell all of my clients regularly is that you don't work for me, I work for you.
Yeah.
And if ever that feels reversed, that's a problem.
100%.
Because you pay my bills, you came to me. And so if ever, and this is part of the reason I solicit feedback regularly. That's actually part of how I was trained, to have feedback like a couple times a month from people, just to see what's working, what's not working, and so forth. But gosh, God, we've hit a nerve, gang. Like I'm looking at all these questions coming up in the chat. Like,
we are 10 questions in, and many of them are multi-sentenced.
Yeah,
I would almost say,
this is a thing.
I'd almost say, tell you what, let's hit on what we were saving for after the break in this 10 minutes leading up to it, and then after we do our quick reminder in about 10 minutes, we're just gonna hit questions. How's that sound?
Yeah, that's great.
That's great.
Okay, so this one, not addressing any specific question that we've gotten so far, but we were going to talk about what to do. So what can you do in these situations?
Well, I like to think about questions leading into therapy. Like when you're going in to meet a therapist for the first time, and more are offering just sort of meet and greet sessions. Mitra does this. I do that.
Fantastic. Love it.
Because I don't want to bring people and charge them for an intake before they've met me, and then they realize, oh yeah, our personalities just don't match.
Yeah,
I'd feel awful charging them for that, when that could have been solved by a 15 to 20 minute just phone call.
Yeah.
And so a lot of the advice I give folks has to do with questions to ask during those initial meetings. But before I turn it over to Mitra, because Mitra's got some great things to say in there, a lot of
Right.
therapists will ask what you're looking for in a therapist. One of the questions I like to ask people is, what are you not looking for?
Always.
Because people have often had experiences where it may have been just a personality conflict, but it was still a conflict. Maybe there was just a level of incompetence, but maybe it was a style difference. But tell me what you're not looking for. Are you not looking for someone who's just going to sit back and say, and how does that make you feel? And how does that make you feel? So what are you not looking for? But Mitra, what are questions that you tell people to ask?
I always ask about a client's experience with therapy. So that plays into the what are you not looking for? But it gives me as a therapist a sense of what worked and what didn't work for you. So I would want someone to be able to share some of that, and I want them to feel comfortable asking me how I work and what that means for my work with them. So I'm a pretty open and direct practitioner. People will often ask, so are you just, I've had therapists who've sat there and said nothing. This is actually a very common one, unfortunately. And I'll be clear, I don't work. I will say things, and I can be directive if that's what you need. Like, not all sessions will lead to you having homework, but is that something you want?
That's
Some
a great
clients really
question, by the
want
way.
homework.
I
Others
would have
don't.
loved to have gotten homework for therapy.
Some people love that.
Yeah. Because it gives them something to focus on in the time between therapy. And honestly, there's so much information to show us how much between session change is important, not just in session insights. And I'm really clear with people, like, insights are great, but insights don't always lead to change.
Therapy does not begin and end at that door.
Exactly. Absolutely. And also, like, everybody knows that alcohol isn't the best for you and smoking can lead to cancer, and yet we all still drink sometimes, and some people aren't unhappy with their smoking habit or aren't quitting. So we all have knowledge about things, but that doesn't necessarily lead to change. Somebody might come into working with me, then they've struggled with something for years. They know they want this to change. And we talked about change in a previous episode. So I think getting into how does a therapist think about change might actually be a useful question too.
Well, that's a question I love to tell my friends to ask when they're going to see a therapist. Like, how do you practice? What theoretical orientation are you using? By the way, for those of you who don't know, theoretical orientation is basically the style of therapy that somebody does. Right. And it's rarer these days that somebody does what I do and like practices exclusively from one theoretical orientation. But that also means I borrow things from others and as flexibly as I can. But asking that question, what's your theoretical orientation? And as a follow-up question, how are you trained in that?
Yeah. The how are you trained in that bit is actually quite important, because I have an additional 2 years of training as a trauma therapist. I don't just kind of I'm not just trauma informed, I'm actually trained in trauma work. And I think that's really important. If I'm going to go to a therapist, I want someone who, if I have an issue in my history that is traumatic for me, I want to know that they can really hold the space for that. And also they can broaden out my picture and my understanding of my own behavior, and my own understanding of, in my case, I would want to talk about fight, flight, and dysregulation, and how all that works for them and how it's felt in the body, because I'm a somatic trauma therapist. So we can get into those kinds of questions. They're really useful to ask your therapist. You want to see not just how they conceptualize themselves as a practitioner, but how they talk about it. How much training they have, how much knowledge they seem to have. It's not that you have to understand everything they're saying, honestly, but to know that they're engaged in their own training process, and that they can talk about that meaningfully, and that they can find ways to help you understand a little bit about it.
Yeah.
So, I'll, for instance, get into talking about, I'm an attachment-focused trauma therapist, so I'll talk a little bit about attachment theory, and I'll try to break it down to, this is our understanding of how you were loved and how your human relationships worked out in your formative years, and some of that will affect how you see the world, right?
Yeah.
So you want to be able to explicate to clients how your own training and process lands in terms of how you are going to work with them.
Yeah.
Right. No, and that's absolutely good stuff that you as the client, potential client, should be asking about. And similarly, one of the other things is Lex the cat, you nailed it.
Bring it up. Yeah.
That you absolutely nailed it. How much experience do you have working with what I'm bringing to the table, and what was the outcome?
Yeah.
Yeah. Absolutely.
I said before we started streaming was for me, I would be like, do you work with people who have ADHD? And I said it sounds kind of weird to say, but I'm like, I assume you're already good with anxiety and depression, so we got that one covered. But how about the ADHD portion of it?
Well, can I bring up something regarding that, Trevor? Yeah. So one of the things you'll see, folks, as people advertise things on the like Psychology Today or Therapy Den or whatever, is there's a lot of things that most therapists are comfortable working with, but comfortable working with something is different than specializing in it. And asking about what do you specialize in is a really important question, because that's also probably going to inform a lot of what somebody does. Mitra does a lot of work with attachment, culture, and identity. I do a lot of work with autism, ADHD, especially in people who are considered, gifted. So our areas of specialty are very different than stuff we're comfortable working with, because we're comfortable working with a lot more than that. But specialty is very different. And bring that up.
Bring that up, because I have a very good working understanding of ADHD and the way it can manifest in relationships.
Mm-hmm.
But I wouldn't say I have a specialty in it the way Dr. B does. So
there.
Yeah. So I would like to do more training in it and just broaden out my understanding. So would I be comfortable working with people with ADHD? 100%. But do I have additional training to work with people in with ADHD? No, not in the same way that someone who's perhaps taken a 6-month something in it or done some additional work. So I'm going to be clear about the difference.
Yeah. Lex the cat had a follow-up and just said, not too sure someone would want to advertise low success with certain conditions. And the thing is, though, is that from my point of view, that's a massive red flag, because that should just be honesty with it. And also, like Dr. B was saying, they work for me. That's like a job interview. If that's them lying on their CV.
Oh, totally.
Totally. Well, and also, yeah, sorry, I was going to say, way before the internet was really big, I remember going to see a couples therapist with my partner, and it was a sort of somebody who was referred by somebody else, and it didn't work out super well. But what I remember was looking in the white pages, and she had her name, and then it was miracles happen.
Oh,
like, you know what?
Oh no.
Miracles
in the United States, that probably ain't ethical.
Oh,
I'm not sure it was ethical here. In fact, I don't think you don't want anyone, because this is really veering into the sort of positive, not even positive psychology, but like the sorts of things that motivational speakers often promise, or coaches will often say, and I 100% back away from that stuff. Like that's not even
Caleb Merritt in the chat, yikes. Yeah, big yikes.
Yeah, totally. You want a therapist who's going to help you do your changing, right? And so change is up to the client, but therapist's presence, relationship, joining, support can help you look at things differently. But the person who actually makes a change is the client.
Yeah.
But let's talk about transparency for just really quickly before we have to go to break. Lex the cat, you say, I'm not too sure that someone would want to advertise low success with certain conditions. I 100% would be, because ethically, I need to do what's in best interest of a client. And if I don't have a ton of experience working with something and they really are determined to work with me personally for some reason, I want to be 100%
Yeah.
transparent about that. Say,
Yeah.
hey, I get that you want to work with me personally because we just click, but I need to be upfront that
Yeah.
I don't have a ton of experience here. And I think for your sake, I want to refer to someone else.
You have to. This is
Yeah, that's
unethical to do
ethics.
otherwise. And this is what leads to complaints against therapists, rightly so. And having done work in that area for my association, I can tell you that no, if you feel as a therapist at all out of your depth with something, your client should know. Like, for
Yeah.
instance, I don't do EMDR work. I worked with a client who really wanted to give EMDR a go.
I don't do that
So
either.
I referred out to a fellow therapist who does EMDR. The client saw that therapist for the EMDR and came back to see me to actually do some of the processing work around it, which great. Right? Because, they got what they needed and they still didn't lose me as their therapist, which is one of the things they wanted, but they gained another therapist who could be there for them and really offer something special that I wasn't offering. So it's not like referring out always leads to you'll never see that therapist again. If you wanted it to, it could lead to you actually having more support in your life and having different therapists for different reasons. But it's a problem if I were to say, well, I guess I could give it a go with a client. Are you kidding me? That is a specialization all unto itself. And it's excellent trauma work for someone who needs it. So you have to be really upfront and you should expect your therapist to be really clear about what's in their wheelhouse and what isn't. And I am super clear with clients as best as I can be about that.
I gotta be honest, a therapist quoting MacGyver does not instill a lot of confidence in me.
I could do it. I could do it.
Yeah, but I wouldn't want you to say it about a therapy session,
I could do it.
I'm gonna go in there, I gotta stick a bubble gum and a toothpick. We're gonna solve this person's anxiety. Anywho, let's take a quick break to remind our viewers of our disclaimer, and then we'll come back and answer well, maybe, I don't know how much time we have, but possibly your questions. We'll be right back.
Champions of Psychology is meant as education and entertainment. It is not a substitute for medical advice or professional counseling. Discussion of mental health topics will be primarily rooted in research and the personal experiences and self-disclosures of the hosts. While we can provide generalized education and possible mental health resources, we cannot offer any recommendations, advice, or opinions for any specific persons, cases, or situations. We provide these resources and links at our sole discretion, but have not necessarily vetted or reviewed any resource. We assume no liability for the use of the information or resources on these sites, and we encourage you to use your own best judgment.
Okay, so, well, actually, first, let me make sure that we're actually back and that I'm not just talking into a void. We're back. Hey, we're not talking into a void. First question is going to be Kilana _ Kurozakura. I'm going to go with Kurozakura. I can't say it that quickly. I apologize. You know who you are. Thoughts on psychedelics-assisted therapy, parentheses, MD asking.
My thought is that is a thing. No, there's so many avenues of research out there, and I know that that's a growing area of research. I also know it's a growing area of research I was neither trained in nor have a ton of experience working or co-working with. So what I would say is, find somebody who really specializes in that, is up to date on some research, and ask them, because that is a very specialized area of practice.
Mm-hmm. And so here in BC, I've got some clients who are trying some microdosing, and they're really, as far as I can tell, there's maybe one or two practitioners that I know of. But again, as a master's level therapist and certainly even a psychologist isn't going to prescribe, right? So
not generally.
That's right. And so I really encourage them to talk to a GP about it, to make sure it's working with any other medications they might also be taking, because it's a risk. And then if I'm seeing them regularly, it's great because I can keep an eye on how things are progressing for them and note what's going on with mood and what's shifting for them, if anything, because I can be the subjective experience of medication is always different than the objective one, or than what is observed by those around you, you know. So particularly for clients who live alone, or because I have several who live either alone or they're the only adult in their house, I want to be able to support them by keeping an eye on how things are going for them and ask them regularly questions about their how they're doing emotionally. You know, we can do some scaling questions. We can just try and create some kind of record of how it's going. And so that's one of the ways I can work with people, but I'm not the prescriber, and I make sure a GP is involved, because that's not, you know, if you can't find someone who really has expertise, yeah, I'll support you. I'll do my best, but I am not, and I'll be very clear, that's not an area of expertise for me, but it's a growing area of curiosity for clients, for sure.
Okay, good to know. Let's go to Cupid XV. Question: I've been seeing a therapist for 5 months. Have established they are not giving me the help that I need out of these sessions. While looking for one more in the field I need, is it better to still attend, or with the ill fit, or to stop therapy until I find a better fit?
You know, we can't directly tell you what's going to be right for you. So let me preface it with that. We don't know you. We're not your therapists. We can't tell you what's right for you. What we can say is that's a really common situation where there is either ineffectiveness or maybe even an interpersonal conflict that's going on in a therapeutic setting, and wanting to essentially find a new fit. One strategy that people try is addressing it directly in the therapy session. And one might say something along the lines of, hey, I have a concern that I would like to bring up. And seeing how a therapist addresses that. That's one thing a lot of folks try. Another thing is, you know, you can stop it. You know, it's your therapy.
Yeah.
People will often just stop therapy if they feel like that's the best course of action for them.
Yeah.
Again, we can't tell you what's going to be right for you, because we don't.
Yeah. I think that is the best thing.
Yeah, and I'm going to say that finding yourself in a situation where a relationship is unsatisfying, where you are also paying for that relationship essentially, is to my mind problematic.
Yeah.
We tolerate a lot of things in our lives. We tolerate family members that we're not, you know, we don't necessarily have a really sympathetic relationship with. We tolerate this with coworkers. I want you to consider, like, why are you tolerating this in your therapy?
Yeah.
And there may be some good reasons. There may be some other outcomes that are working in therapy, but I think that's a question that is important to ask yourself.
Yep.
Yeah.
I was planning on asking my old therapist that, and then COVID hit, so I didn't see them anymore. Okay, let's go to Caliph Marin. Question: how do I find how to find the right therapy in my tough spot for an autistic, depressed, super anxious, cosmic treadmill brain? I like that. I've tried CBT, I've tried talk therapy, I've tried groups, and I just don't feel any better, to be honest.
Well, okay. This kind of falls under this similar thing. Like we don't know what your situation is entirely. What I can say from my own perspective, being ADHD, autistic, struggling with chronic depression, is that it's really hard for me to find a therapist that I can click with. Because my experience is most therapists don't specialize in adult ADHD or adult autism. So that's one of the first things I look for when I look for a therapist, and I'm looking for one again. What's your level of experience with ADHD and autism in adults? Because someone who's familiar is very different than somebody who specializes, who understands things like some of the secondary manifestations of autism, like alexithymia and interoception challenges, some of the relational difficulties that come from the expectation that even if you're autistic, you're supposed to socialize neurotypical, which is just weird to me, but c'est la vie. They outnumber us. They have expectations. That's one of the first things I look for, is someone who really understands my situation. And for me anyway, it comes back to what we said at the start, that the technique is less important than the relationship. And research really substantiates that over and over and over again, that the relationship you have with the person is twice as effective in the outcome as whether they're psychodynamic or cognitive behavioral. Although I personally, if somebody came at me with psychodynamics, that would not mesh well with me. But I know that about me.
Yeah, I think that a person who's willing to hear your situation and your experience of your situation is going to be able to make a difference for you. I do think that if you have, I think that really, Dr. B, you laid it out so well in terms of what you're looking for, in terms of someone's understanding of autism and ADHD, like being able to really support and lead you to understand parts of yourself that you may not have fully mapped out in terms of your experiences with it. Or just kind of have a bit of a roadmap for how you can cope with certain things that you kind of are encountering but haven't named yet, perhaps. You really do require someone with a specialization to be able to do that. So I can often help clients work out some of the areas that need to be filled in or that they need to make sense of. Whether I'm the therapist who can further that and actually make sense of it, I may not be, right? But this is where I think it's so important to have that relationship where I am allied with my client, and I am in supporting their journey, and it's their journey, right? So as a clinician, that's the most important thing.
I like that. Okay, let's go to Garwar. Garwar has a question. Have you seen the preview of the new documentary featuring Jonah Hill and his therapist? If so, do you think it will encourage people to go to therapy? I have not heard of this. I did not know about this.
I am going to check it out stat. Like, that's really...
That sounds interesting.
Yeah.
Jonah Hill is a very interesting person. Yeah.
So this is actually documenting his therapy,
I guess. Yeah, that's interesting.
How does that change the experience of therapy? To be documenting it.
I mean, the Hawthorne effect's a thing. For those of you playing the home game, Hawthorne effect is this idea that anytime somebody's behavior is being observed by a third party, their behavior will change.
Yeah.
So your therapy, I mean, if you're in therapy being filmed, your therapy's gonna be different.
Yeah. That would.
I mean, I do think it's interesting that people who are filmed in therapy often talk about how they end up forgetting the cameras are there. But I've always been curious about that. Remember, oh my goodness, my brain isn't working. Gottman's work. Remember Gottman's work with the couples? Yeah. So they were in cabins and they were filmed, not the whole time, but like a considerable part of their time, so that I think initially so that he could make sense of how their relationship was manifesting. And I may be remembering this incorrectly, but what I do remember is that initially it was quite a stiff experience in the sense that they were kind of uncomfortable because of the cameras, but then eventually they started to forget about the cameras.
Mm-hmm.
But I don't know.
I don't know.
I think
to get to Garawar's question really directly.
Sorry, yes.
I don't know. Garawar documentaries are edited to present a certain message, and therapy in and of itself is not particularly cinematic, and it's usually boring and slow and filled with details. And the way they cut that together could be something that could make therapy look exciting and inviting, which should be one of those things. I would hardly ever call therapy exciting.
I worry if it's exciting.
Yeah.
What exactly is going on there?
I don't know. It's just breakthrough after breakthrough.
Yeah,
this Tuesday, you will have your own personal breakthrough with this therapy every day.
Sunday. We're breaking down those mental walls.
You pay for the degree, but you only need the breakthroughs.
Yeah.
So,
it's not how therapy is.
No, it isn't.
In the least.
Blushing Crafter did say, yes, documenting his therapy journey, conversations with his therapist too, interviews with him as well. Also, this is why the lurking writer and I get along. That's quantum therapy. The act of observation changes the thing being observed. I thought the exact same thing.
It's
perfect. But I don't think when the Hawthorne effect was named, anybody understood what quantum theory was. It was like 100 years ago.
I'm just really appreciating the way we can put those two things together now. Then
quantum therapy.
You get the camera in there, and the therapist is just like, I don't know. You seem more like a wave right now. It's not what I was expecting.
Ooh.
Okay, let's go to gelatinous Rubik's Cube. Fantastic name. Question. Are there a few base schools or types that? Hang on. Are there a few base schools or types that these offshoots come from generic enough cover to get some understanding? I think this is like the types of the therapy.
Sure.
How do you find out about those?
I think I can do it pretty quickly.
Oh no!
Excellent.
Do you have
Go
a
for
song?
it.
I think I do not have a song. I actually would love if there was like Wacko's World of psychology, like psychodynamic, cognitive behavioral, but that the patter doesn't work. I would psychodynamic. Conditioning operant. I don't know.
All right.
Anyhow.
Okay. So in big broad strokes, psychodynamic theory, that's like Freud and all of his descendants. Okay. That's the stuff that really looks at early childhood experiences first and foremost, and how they have a really strong deterministic impact on our behavior. They're the ones that look at all the unconscious stuff, defense mechanisms, and so forth. Then there's pure behaviorism, which is just cause and effect, reward and pairing type stuff. Then there's cognitive behavioral, which is what I do exclusively. And that tends to be very present focused, though we do consider the past really heavily and how it forms in the present moment. But we're looking at how our thoughts affect our behaviors and emotions. It was really revolutionary in the 60s when that was when that was conceived. But then you've got things like humanistic centered therapies, things like person centered, which is Carl Rogers, unconditional positive regard, lots of affirmations and self-actualization at the principle, existential forms of therapy, which really look at choices and responsibilities. It's all just different lenses for looking at similar ideas. And every one of us just has a different kind of, the way I like to think about it is we all have a different lens through which we look and a different language that we speak to get to the same goal.
And more recently, you have somatic variations of therapy, starting with Peter Levine's somatic work, and then Sharon Stanley's somatic transformation. So Levine came up with somatic experiencing. Stanley and Alan Shore's work comes out of, or I think Alan Shore was in there, and then this is why he does the talking about these things, because
Alan Shore, that was James Spader in Boston Legal, right?
Jesus.
No, Don't get started on me.
Don't you dare bring up
Anyway,
Boston legal.
you've got a whole newer tradition of somatic therapists and people who are doing trauma work and understanding the effects of trauma in the body, like Bessel van der Kolk.
Mhm.
And so a whole set of therapeutic interventions and thinking about therapy through that lens. So, yeah,
Yeah.
Okay.
And
come a long way in trauma therapy.
but so those are really the big categories, like psychodynamic almost nobody does pure behaviorism these
Right.
days.
You're
But
forgetting about attachment theory and the therapies that also come out of that.
well, so the reason I didn't specifically mention attachment theory is because attachment theory was an offshoot of psychodynamic, wasn't it?
It's true that came out of John Bowlby's experience and early childhood, but it's branched since then into understanding how attachment thinking or attachment behaviors
Right.
that start in childhood but follow us throughout our adult experiences. So we now have the adult attachment interview and really understanding more broadly how attachment actually affects many facets of our life, including our attachment to place. That was my research right there.
Nice.
But anyway, yeah. So there's a lot of different ways. I think you're getting the idea of all these different flavors of both the lenses we can look through in terms of helping relationships and the sorts of theories that underpin those lenses.
Okay.
Yeah, so those are the big categories, and you can ask about, like, if somebody has something you haven't heard of, how it like connects to all of those.
And this will be available as a VOD later on our YouTube in case you didn't catch all of those.
And also, we can expand if anybody is having difficulty sleeping, we can always expand on this and sell it for $4.99 a piece.
You mean how like Jordan put in the chat that I literally feel like I'm in college right now? I loved that.
For $4.99, we can help put you to sleep by lecturing you on psychotherapy, history, and systems.
And we can do it very slowly and in a somewhat monotonous tone of voice.
We'll
Except
get
5 hours in, I'm going to be like, ah!
We'll get Tom Sturges that played Dream and Sandman to read it all for you. Here's the thing: we're actually running low on time here.
No.
We barely scratched the surface. We didn't even get halfway through this.
We're doing this again.
Please remember that we are going to do a Q&A episode at the end of the season. So we'll be going back and taking a bunch of questions from the previous season, this season, and talking about them on that episode. I've actually highlighted a few of these to talk about there, but this also might just be a good one to do another episode of, because we got a lot of questions about this.
So many questions. Y'all were active.
Yeah, so this might be something that we revisit. But I think this is a good place to start wrapping up the episode. Friends, where can people find you on the interwebs if they would like to do so?
So I'm available on mitrajordan.com or, of course, at Mitra Jordan, where I occasionally check my Twitter feeds. So I'm sorry. Unlike Dr. Boccamazzo, otherwise known as Dr. B, you see where he is? Yeah, he's everywhere. That's why he's looking around. He's finding all the different versions of him that are everywhere on social media,
Instagram,
right?
Yeah, the one on the left wears more hats. The one on the right is more dour.
But who brings out Nicolas Cage?
Everyone.
Oh, Nicolas Cage comes of his own accord.
Yeah,
he lurks.
He lurks. Do you see him there? He's lurking.
I do see him lurking.
But you can find me on pretty much all the socials at the Dr. B, TheeDoctorB as in boy. But more importantly, follow Take This at Take This Org on, again, most of the socials. Celebrating our 10th anniversary next Monday, the 7th of November. So excited about that. I think we're gonna have a special stream.
Heck yeah, that's awesome. Keep an eye out for that. I think that's going to do it for this week's episode. Thank you to Codename Entertainment and Take This for giving us the opportunity to have these discussions. Thank you to Jordan Mars for moderating the chat and doing a fantastic job. And thank you to Chad for just asking a bunch of really good questions. I'm very sorry we weren't able to get through all of them, but we will do our best to do so in the future. Let's see. I believe the rest of the week is normal, but I didn't do the schedule this week because I'm actually on vacation. I'm not actually here right now. Who knew? So be sure to check out our Reddit, Twitch, or not Twitch, Reddit, Twitter, and Discord for what the schedule is going to be like, so you can keep it up to date on all the shows on twitch.tv/CNEgames. But yeah, I think that's going to do it for this week. So until next week, take care of yourself.
Champions of Psychology is meant as education and entertainment. It is not a substitute for medical advice or professional counseling. Discussion of mental health topics will be primarily rooted in research and the personal experiences and self-disclosures of the hosts. While we can provide generalized education and possible mental health resources, we cannot offer any recommendations, advice, or opinions for any specific persons, cases, or situations. We provide these resources and links at our sole discretion, but have not necessarily vetted or reviewed any resource. We assume no liability for the use of the information or resources on these sites, and we encourage you to use your own best judgment.